Hi everyone, we are going to do our skin lecture today. I am going to start off talking about bacterial infections, viral infections, fungal infections, pediculosis, and contact dermatitis. Bacterial infections, these are the most common in childhood along with fungal and viral, that's why we're talking about them. Our representative condition for bacterial is impetigo. A bacterial infection, who is at risk for getting one? Any children with congenital or acquired immunodeficiency disorders, any children who have a debilitating condition, children receiving immunosuppressant therapy, or if a child has a generalized malignancy such as leukemia or lymphoma. Anytime they come in with an infection, we culture it if we can, if there's any drainage, so we can diagnose it to make sure we know what we're dealing with. When it comes to nursing care and bacterial infections, our main goal is to prevent the spread and to prevent complications. Complications would be it becoming infected, turning into something more. So make sure you're doing your skin assessment, making sure the area is clean, applying any treatments that could be ordered. Make sure that you're checking the nails, making sure they're trim and clean, and also educate on all of the things that we're going to talk about here to prevent the spread. One of the most important things is that the child doesn't touch the area, because they could spread it to other areas or they could spread it to other individuals. Hand washing is so important. Obviously, we're seeing a ton of that in the news right now, and a lot of the education is aimed at children as well. Separate towels when we're dealing with bacterial infections in the home. Pajamas, clothes, they should be changed daily and washed in hot water. If the child has a bacterial infection and they're old enough to shave, make sure they are using a new razor after each use, or and no sharing of razors for sure. Some infectious disease folks will recommend taking a chlorine bath twice weekly with one teaspoon of chlorine per 1 gallon of water. If there's anything that could be squeezed with a bacterial infection, no squeezing. That can obviously lead to spread and cellulitis, and then getting them into the hospital with that. Cellulitis can be limited, cellulitis, if limited, can be managed at home with PO antibiotics and warm compresses. Obviously, you guys, a lot of you have probably seen patients with cellulitis in the hospital. That's where we're giving IV antibiotics, doing dressing changes, treatments, and we're doing usually warm, moist soaks in the hospital. Viral infection, one of the most common things we see in kids are warts. Those are the most common in children, plantar warts. The treatment for viral infection is local destruction. Also under the viral infection category is herpes simplex virus type 1, type 2. Type 1 is generally above the waist. Cold sores. Type 2 is herpes simplex of the genital area. Varicella zoster, chickenpox may follow exposure. And then obviously in the adult world, there's shingles that we worry about. When it comes to fungal infections, a representative condition is ringworm. The nursing care for that is to emphasize good health and hygiene. Don't exchange grooming items such as hats, helmets, brushes. They should, again, with this one, use their own towels and new towels every day. Wear a head covering at night. One thing to note with ringworm, we can have it on the head or the body. If it's on the head, we see circular scaly patches with or without alopecia. It begins in the scalp and it could progress towards the neck or hairline. If we see ringworm on the body, it's circular scaly red patches. We can have animal to human transmission, so make sure you're examining all household pets for ringworm. Other sources of infection are seats with headrests, so think about theaters, airplanes, public transportation, and again, helmets. We don't want kids sharing helmets. The care for ringworm, shampoos if it is on the scalp, and also an oral therapy, an antifungal. The shampoo we apply to the scalp for 5 to 10 minutes, 3 times a week. The child can go back to school once therapy has been initiated. The oral medication that we use, I'm going to spell it for you guys. It's Griseofulvin, and they can be on this medication for weeks to months. If it's on the head, they're typically on it 6 to 8 weeks. When they have ringworm on their body, they're usually on it for months. Make sure there's a few things educational points we want to make sure we're discussing with the parents and the patient. It's very important to take this medication with a high-fat food. It's best for absorption. We need to make sure that they maintain their dosing schedule, even as symptoms disappear. This is another one we want to keep taking them, or taking this medication. There are some long-term use side effects that we need to worry about. We're worried about leukopenia, and we're also worried about renal and liver functioning. So they'll need to have their blood work taken periodically to monitor those functions. Some side effects of the medication can be headache, GI upset, fatigue, insomnia, and photophobia. The next one we're going to talk about is pediculosis or head lice, where typically there's over-the-counter products, Nix and Rid. They're effective, and again, we don't need a prescription for these. Although the efficacy of these two medications, we're seeing lice actually being more resistant to these medications. So that is something to think about as well, the concerns about the growing resistance to those two. You apply these topically, and then you manually remove the nick casings with a metal comb from the hair. If you are using Nix or Rid, you definitely need to be careful with children who have asthma. It can be a trigger for asthma. So we definitely would want to use cautiously in that patient population. The big thing to make sure you're educating everyone on, parents and the children, that anyone can get this, and typically lice, they like clean hair. If you can send your, especially school-age child, to school with some product in their hair, and there's some different products you can use that our lice don't like, they say it does help. But again, same thing here, no sharing of combs, no sharing of hair items. The same thing with the helmet. If your kids are playing sports, make sure you get them their own helmet and they don't share. If all wash all washable items on hot water and then dry them in a hot dryer. Make sure we're vacuuming carpets, car seats, stuffed animals, rugs, mattresses, and furniture. Anything that's non-washable, we seal in a plastic bag for 14 days. You can also soak combs or brushes in lice-killing products for 1 hour or hot boiling water for 10 minutes. Our last condition is contact dermatitis. This is an inflammatory reaction of the skin. This is kind of more your poison ivy, so exposure to wild plants. The area of reaction will vary depending on exposure. The reaction can be anything from a mild case to a severe case. You can see redness, swelling, blisters, itching. The nursing care for contact dermatitis, and again, the poison ivy is just one example of that. We see contact dermatitis all the time as a diagnosis when we're not exactly sure why they have a skin infection. It's not being caused by a bacteria, a virus, or a fungus, but something's irritating their skin. If they are exposed to wild plants, the oil on the plant, we want to make sure we're rinsing the area with cold water. Remove and wash all clothes that came into contact with the oil. Some things that you can use for comfort, calamine lotion, oatmeal baths, topical corticosteroid steroid gels. We can use antihistamines, sometimes antibiotics, again, if we get ourselves into a situation where we've been scratching and we're getting towards the road of infection. Again, no scratching. So the younger the child, maybe we have to put socks on their hands so they don't itch, or gloves. Again, make sure their nails are trimmed really short and make sure their nails are clean. You can do some education to prevent when they go out, long sleeves and pants if we know they're going to be playing in a wooded area. We talked about already removing the clothes as soon as possible, watching for infection. We talked about the fingernails. We talked about clean skin. There are medications that we can also order for itching as well if the calamine lotion and the oatmeal baths and the topical corticosteroid gels aren't working. So there are some other medications we can get for more severe cases. All right, that is that for this part of the lecture. I'm going to do burns under another recording.